today we can stay healthy in this pandemic situation. So in this occasion, I'm going to talk about a very common topic among the teenagers all over the world. But before we get to the presentation, let me introduce myself first. My name is Putu, Yenita, Sylvia, Agustina, and you can call me Yenita. So, have you ever heard about anxiety disorders? Or maybe there are people around you have talked about it, or perhaps you're the one who is struggling with anxiety. Whatever's the answer, you made the right choice to watch this video because I'm going to talk about anxiety disorder. So what is anxiety disorder? Why are there so many cases about it out there? So according to the DSM-5, anxiety disorders include disorders that share features of excessive fear and anxiety and related behavioral disturbance. So I can conclude that anxiety disorder is a mental health disorder that characterized by the feelings of worry and fear, and these feelings are strong enough to interfere with someone's daily activities. So my talk will be in three parts. In the first part, I'll explain about the signs, about the symptoms of anxiety. Then in the second part, the types of anxiety. And finally, I'll go on to talk about the treatments for anxiety. Now, let's turn to the first part of my talk, which is about the signs and the symptoms of anxiety. The symptoms of anxiety conditions are sometimes not all that obvious as they often develop slowly over time. Basically, each anxiety condition has its own features, but here I'll tell about some common symptoms of anxiety. There are three things to consider. First, the physical symptoms like panic attacks, hot and cold flushes, racing heart, tightening of the chest, quick breathing, or feeling tense, wound up, and edgy. And the second, the psychological symptoms like excessive fear, feeling worry, catastrophizing, or obsessive thinking. And then the third is the behavioral symptoms like avoidance of situations that make you feel anxious, which can impact on study, work, or social life. Then, that completes the symptoms of anxiety. Let's move to the next part, which is about the types of anxiety. There are many types of anxiety, but the most common are these four things. The first is the generalized anxiety disorders, or well known with GAD. So this type of anxiety makes a person feel anxious on most days, worrying about lots of different things, and it can be for a period of 6 months or more. And then second is the social anxiety. This type of anxiety makes a person has an intense fear of being criticized, embarrassed, or humiliated. And even in everyday situations such as speaking publicly, eating in public, being assertive at work, or making a small talk. And then the third is the specific phobias. This type of anxiety makes a person feels very fearful about a particular object or situation. And then the fourth is the panic attack disorder. This type of anxiety makes a person has panic attacks, which are intense, overwhelming, and often uncontrollable feelings of anxiety combined with a range of physical symptoms. Someone who having a panic attack may experience shortness of breath, chest pain, dizziness, and excessive perspiration. I've explained about the types of anxiety. So now we come to the last part, which is about the treatments for anxiety. There are two common treatments for anxiety, which is the first, the psychological treatments, which also known as talking therapies. There are several types of effective psychological treatments for anxiety, like cognitive behavioral therapy or CBT, behavioral therapy, and e-therapies or online therapies. And the second is the medical treatments. Actually, research shows that psychological therapies are the most effective treatments of young people with anxiety. However, if the symptoms are severe, some medical treatments may be helpful, like some types of antidepressant medication can help people to manage anxiety. Even if they are not experiencing any kinds of depression, antidepressant medication is designed to correct the imbalance of chemical message between the nerve cells in the brain and even make someone with anxiety feels better. Okay, that's all I want to say for now. I hope you guys enjoy my video and thank you for watching. Goodbye.